Welcome back to RN Toolkit. In this video, we'll break down the head, face, and neck assessment, covering cranial nerves, lymph nodes, thyroid exams, and the red flags every nurse needs to know for clinicals and the NCLEX.
So here's our game plan. We're going to build this up step by step, starting with the basic anatomy and taking it all the way to how you apply this in the real world with patients. All right, let's get into it.
First things first, before you can assess anything, you have to know the terrain. We're going to start with those key anatomical landmarks that you've got to know by heart and by feel. And trust me, this isn't just about memorizing words for a test. This is about building a mental map that's going to guide your hands and your clinical thinking every single time you see a patient. Okay, let's start with a really important one for getting your bearings on the back of the neck. It's called the vertebra prominence. All you do is have your patient tip their head forward, and you'll feel for the most prominent bony bump at the base of their neck. That's C7. It's your perfect starting point. Now let's move around to the face. We're going to find the TMJ, and you'll get a lot of patient complaints about this joint. So find that little flap of cartilage right in front of the ear canal. That's the tragus. Now just slide your fingers forward from there, have the patient open and close their jaw. You should feel a nice, smooth movement. What you're listening and feeling for are pops, clicks, or any kind of grinding, which we call crepitation. And here are the other big players in this area. You've got the parotid glands way back in the cheeks. Here's the thing, though. You shouldn't normally be able to feel them. If they're swollen, you might think about something like mumps. The submandibular glands are tucked right under the angle of the jaw. Then, of course, you have those two big, ropey neck muscles, the sternocleidomastoid for turning the head and the trapezius for shrugging the shoulders. Now let's talk about the wiring that makes it all work. Okay, so we know the parts. Now let's look at the cranial nerves that are pulling the strings. Think of these as the electrical wiring, and checking them gives us a direct window into the central nervous system. All right, here's a classic scenario you will definitely see in practice. Your patient can't really tell the difference between a sharp or dull feeling on their cheek. So take a second. Which nerve are you immediately thinking about? Bingo! If you were thinking cranial nerve 5, the trigeminal nerve, you absolutely nailed it. Sensation for the entire face. We're talking pain, touch, everything. That's its job. This chart is your cheat sheet for the most important nerves in this exam, and you can see how the function tells you exactly how to test it. For cranial nerve 7, the facial nerve, it's all about symmetry. Ask them to smile big, frown, lift their eyebrows. Does one side droop or lag behind? And for number 11, the spinal accessory, you're testing those big neck muscles. Just have them shrug their shoulders or turn their head while you provide a little resistance. Easy. Okay, let's get practical. A huge part of this assessment is checking the lymphatic system. So how do you actually do a proper hands-on check of the lymph nodes in the head and neck? How you do this really matters. You're going to use the pads of your fingers, never the tips, and use a gentle circular motion. See, if you press too hard, you'll just mash the node into the muscle underneath and you won't feel a thing. And here's a pro tip. Always use both hands to feel both sides at the same time. It makes comparing them for symmetry so much easier and faster. Because what you feel tells a whole story. In most healthy adults, you're not going to feel much of anything. But in a kid, it's totally normal to feel some small, pea-sized, movable nodes. Now, if someone has an infection, you'll feel nodes that are bigger, warm, and tender. But the one that should make your internal alarms go off, a node that's hard as a rock, doesn't hurt, and feels stuck in place. That is a major red flag for malignancy. Okay, this is a big one. Context is everything, especially when it comes to age. What's perfectly normal in a baby could be a huge red flag in an older adult, and the other way around. So, 4 months. Why is this number on the screen? This is the magic number for head control in an infant. By this age, when you pull a baby up to sit, their head shouldn't lag behind. If it does, that might signal a developmental delay that we need to look into. An infant's soft spots, the fontanelles, are like little windows into their health status, and you're looking for two opposite but equally critical signs. A sunken fontanelle? That baby is likely dehydrated. But a bulging, tense one? Whoa, that's a sign of increased pressure inside the skull, and that's an emergency. Now, not everything you find is a problem. Let's talk about some normal variations so you don't raise unnecessary alarms. It's totally normal for a baby's head to be bigger than its chest. It's also pretty common to hear a soft whooshing sound, a brute, over a young child's skull. And for pregnant patients, a slightly enlarged thyroid is expected. Knowing what's normal lets you focus on what's not. All right, you've got the foundations down. Now let's put on our detective hats and talk about spotting when things go wrong. These are the conditions and red flags you're almost guaranteed to come across. You will see this comparison again, I promise. On exams, in clinicals, everywhere. The two ends of the thyroid spectrum look very different. Think of it like this. Hypothyroidism is the body slowing way, way down. So you get puffiness, fatigue, dry skin. Hyperthyroidism is the body in overdrive, racing heart, weight loss, and those classic bulging eyes. Headaches are tricky because they're so common, but you have to know how to tell them apart. Migraines and cluster headaches are awful, for sure. But listen up, the one you absolutely cannot afford to miss is meningitis. That combination, a brutal, sudden headache, plus a high fever and a stiff neck, is a go-to-the-ER right now situation.
Okay, so your assessment is done, you've charted everything, but your job isn't over. Not even close. This next part, education, is where you actually get to make a huge difference in someone's health. This right here is why your assessment skills matter so much. They create the perfect moment to teach. For those new parents, explaining that tummy time helps prevent flat spots on their baby's head is gold. And for that high school soccer player, teaching them the signs of a concussion isn't just good info. It could literally save their brain. And that brings us to the final and maybe most important point. An assessment gives you data, but your real value as a nurse comes from using that data to empower your patient. So I'll leave you with this question to ask yourself after every single patient encounter. What is the one thing I can teach this person right here, right now, that could truly make them safer and healthier? That's when you go from just being an assessor to being a real advocate.